Typically what you're going to need is a stethoscope with a blood pressure cuff, along with a thermometer of some type, a pulse ox, a watch, and some gloves, along with a disinfectant wipe to clean the items that are not disposable. Then what you want to do is you want to perform hand hygiene and don the appropriate PPE if necessary. Like if your patient's in contact precautions, you'll want to put on the correct PPE. Now, what is collected during the vital sign measurement? Well, you'll be checking the patient's blood pressure, heart rate, respirations, and temperature. In addition, you'll be asking the patient their pain rating, which is sometimes referred to as the fifth vital sign, along with collecting their oxygen saturation. So I've arrived to the patient's exam room and I've performed hand hygiene. Now what I want to do is I want to introduce myself to the patient and tell them what we're going to be doing. So hello, my name is Sarah. I'm a nurse here and I want to be taking your vital signs. Is that okay with you?
Yes.
Okay, then you want to do your patient identifiers by looking at their armband, having them tell you their name and their date of birth. Then I like to start with the easiest thing, which is pain. And so I'm going to ask him his pain level. Now this is a very easy and important assessment tool because high pain ratings, if the patient is in pain, it can alter their vital signs. It can increase their heart rate, their blood pressure, and respirations. And it's really important, especially to ask a patient their pain level if they've just had surgery or some type of trauma. So to assess pain levels, you can do that with various scales. Most commonly, we use the 0 to 10 numerical scale. So can you tell me your pain, with 0 being no pain at all to 10 being the worst pain you've ever had? What's your pain rating?
0.
Okay, he says he's having no pain. That's easy. But let's say that he said that his pain rating was an 8. Well, you would want to ask some more questions. You would want to say, where's your pain located at? And please, can you describe it for me? Like, is it burning? Is it radiating? Things like that. And then you want to document that, the numerical rating, along with the words that the patient used to describe the pain and its location. Next, we're going to measure the patient's oxygenation status. And to do that, you can use a portable probe like this one, or one that connects to a bedside monitor. And to do that, you're going to place the device on the nail bed because that's where it's going to obtain the reading. So make sure that you pick some fingers that have good circulation. They're nice and warm and pink. So we'll turn on our device and we will place it on the finger and let it get a reading. And here the patient's oxygen